It's a different kind of video.
Lean down a little bit so I don't.
Welcome to the K9s for Veterans podcast, Operation Honor. Join us on this amazing journey. Hosted by Michael Tellerino, your guide through these inspiring stories along with special co-host Kenny Avery. In this podcast, we will share personal stories and highlight impactful programs that empower our veterans. Discover the impact that service dogs have in the lives of veterans. Tune in to witness heartfelt moments and transformational journeys. Get ready to connect, learn, and be inspired by our veterans' stories. Operation Honor is here to uplift and empower. Let's begin this important mission together.
Thanks for joining me tonight. My name is Mike Tellerino. I'm your host for this evening, along with my co-host Ken Avery. I got two amazing guests with me tonight, Jill and John Jans. John is one of our first veterans in our PTSD program when we first started out, which was many years ago, right, John?
A couple days ago, yeah. It's been a minute.
Anyway, John is here tonight with Jill to talk about the newest treatment for PTSD. And according to John, it really works and it really helped him. John, he's going to tell us all about how he learned about it, the first time he got it, and what it's done for him. John, start off by telling us.
Telling us what, Mike?
Telling him how you learned about it.
First of all, tell us the name of the treatment.
All right, so stellate ganglion block, and it is essentially an injection that you have to have done. It's an inpatient procedure done by a surgeon. An outpatient procedure. My wife is my fact checker and all sources of knowledge, which is she's awesome. She's the reason I heard of it. You get an injection in your stellate ganglion block, which is a bundle of nerves, like right here in the neck.
Okay.
They have to use what is the imaging that they use? Sonogram?
CT scan?
Say again?
A CT?
No, not a CT. What is it for babies? They scan the mom with
Ultrasound.
Oh,
so it's
ultrasound.
ultrasound assisted, and they make sure that they have to hit the exact right bundle of nerves, and they inject I believe it's 7 cc's of like a really potent
I have the
paralytic it's like a lidocaine, and it resets the autonomic nervous system, and within 24 hours you can feel the effects of it actually taking place, and it's a really simple procedure, and I get it done at Hines VA. I had it done at Hines. I think the injection lasts for about 3 months before you have to go in to get a second.
They've only really studied for it to have been done twice on veterans. So right now you're at the threshold. But so I'm going to back up a second. So a few years ago, I was listening to Joe Rogan, and one of the Medal of Honor recipients was on, and he was talking about how he had just had something done that was life-changing. He said it felt like after combat and coming back and trying to live a civilian life with his family and kids, he felt like he was driving down a road that was bumper to bumper traffic. And he had this amazing procedure done, this stellate ganglion block. And it was like all of a sudden he was driving down an open road. And wow. I wrote it down, and I proceeded to ask his doctors about it the next time we spoke. And unfortunately, there was no avenues to progress forward in getting any more information about it. But luckily, he has a really good doctor. And last spring, the doctor informed us that the VA had approved the procedures to be done on veterans at the VA. And there was a person at Hines who was doing the procedures, and he was very familiar with it. And he was recommending us go forward with that procedure as long as the doctor who would be doing the procedure did a evaluation and found that John was needing of it and it would help him. So then we set up that appointment the next month, went in for the appointment, and it was like kind of a basic PTSD screening. I mean, to be honest with you. And the doctor was like, yeah, like you check all the boxes for this. We'll set it up for next month. And then that was when it was end of August
last year.
Yeah. That John had it. And it was you go ahead and take from there. Like it.
So it, like I said, almost within 24 hours, the first like 12 hours or so, I'm not going to lie. Like it paralyzes half your face. You get
Horner syndrome.
It's called Horner syndrome. It looks like you've had a stroke that only lasts for about 12 hours. And that's a good sign.
But that's a sign of a successful stellate ganglion
right.
block.
So it's a good sign if you have this Horner syndrome. But it stings for a bit. But within a day, the pain's gone. And I mean, I was able to have. I've got a 14-year-old daughter that I love her to death, but she is a lot. And our relationship has over the last couple of years started to become strained and tumultuous, yes. And I mean, I'm able to
temperamentally deal with
to deal with her
stressors.
to take whereas prior to having the ganglion block, the stellate ganglion block, I was zero to 100, or I'd have to leave. I couldn't have a conversation with my kid, and I would just yell at her if I did.
And once that first 12 hours had happened, due to the fact that it was around the holidays, so it was like Labor Day was coming up, so fireworks were being shot off.
Yeah.
And that first 12 hours, like John was in a lot of pain, like he had a migraine and everything, so he went home and he laid down in bed. And within maybe like 3 or 4 hours, I was making dinner. I come in the bedroom because all of a sudden a huge firework had gone off, and I come in and he's laying there, and he kind of like sits up a little bit. He goes, "What was that?" I was like, "It's a firework. Why?" And which normally John is very reactionary to those.
Yeah.
But he said, and I quote, I'm waiting for my blood pressure to go up and my heart rate to go up, but it's not happening. And that to me said so much about how the effects of this procedure would be taking hold of his nervous system from that point forward. And I feel like it really progressed in that great of a difference.
We had a lot of I was in Ramadi in 05-06, and it was a pretty bad spot in Iraq at that time, and we had a lot of IEDs and
explosions.
A lot of right. So I have a
hair trigger.
I've got a hair trigger, but I've got a pretty good startle response where if I hear a big boom or something, I will drop to the ground. I'll drop to a knee. I don't know if you guys.
Oh, I am. I hate the 4th of July.
Yeah, exactly. So I'm hearing stuff getting blown up. I mean, close within a few houses of us. I'm not even responding to it, and it's not because I'm like drugged, but because it's like my brain doesn't give a shit.
Wow.
Okay.
I hear it go, and I'm like, oh, okay, fireworks, boom, fireworks, okay.
That's
and that
John, do you have a lot of pain?
From the procedure,
or just in
No.
In general,
when you got that shot,
mm-hmm.
Did it alleviate a lot of your pain too?
Not.
There was.
Because you said lidocaine.
Right, so it's lidocaine, but it's like in a specific spot.
Well,
and she printed out all the paperwork. She can.
It's also used to treat, because technically this is an off-brand treatment, they say, for the stellate ganglion block. It's typically used by a pain management anesthesiologist to treat chronic pain syndrome and like migraines, hot flashes, they said, and it was like one other thing. But PTSD wasn't technically on the list, but they started testing veterans because of the success that they were having with it. So it's supposed to work on your like upper extremities if you have pain there, which John does, but I don't feel like it really did.
It didn't do much for pain for me.
but not having the fight or flight elevated in that regard, I think, did help lessen his threshold for pain all day, every day kind of away. Not that it was gone, but just because it's one less thing that you're carrying in your body all day, every day.
Can you see what the?
Okay, I understand that.
Joe, there's somebody asking a question.
Yeah, she's looking it up right now. But so the procedure itself is like it's over 100 years old. But they just within the last, I'm going to say decade, I'm making that number up, within relatively recently started using it for PTSD. But the procedure itself is really old. They're just finding new new uses for it. But as far as pain, like I've got a headache all day, every day, like right here, that never goes away. And that'll turn into migraines pretty frequently. That didn't, the shot didn't do much for that. And then same with, like I've got the back pain that all the grunts have, back and knees busted. It didn't do much to help that kind of pain. But it seems like it makes everything easier. It makes it easier to ask for help. If I am in pain, I can say, hey babe, can you grab me some Tylenol, or grab this or that? And I don't try to fight myself.
But it brought down your stress level too, right?
Yeah, absolutely. Brought down.
And because stress level is also a key to PTSD. I mean, we lower our stress. You and I know that. Right. We're not as bad as we normally would be. I'm on duloxetine.
I'm not familiar with it,
but I'm interested. Well, it's a PTSD drug, but I'm interested about your shot because it intrigues me right now.
So,
John, how hard is it to get approved for that shot?
It was pretty simple.
His psychiatrist was the one who had referred him to.
Right. So I'm gonna put his name out there. It was Dr. Buckley.
I know him.
Dr. Buckley. He's the one at Hines. I believe he's the head of the psych department. But he's the one that actually performs the procedure. I met my psychiatrist, said, hey, Dr. Buckley, here's a potential patient for you. And I talked with Dr. Buckley for probably half an hour prior to him asking me any questions. I was curious to gain insight on him. And he's an awesome physician, and he started this big push pretty much on his own because he believes in how much of a reward that this procedure has. So he's got so much faith in it that he's been pushing it through the VA, and he's the one. He'll scrub in and do the procedure himself. And
Joe, do they mix it with the steroids? She's asking also.
I don't believe so, but I'm checking the I have in front of me the evidence brief for the stellate ganglion block for PTSD. It's like from the VA. Like I watched a whole thing on it before he had it, and then I printed out the stuff too. So if you give me it's like a 16-page thing, so I got to find where that part's at.
Okay, John. Then, so the first shot, it lasted for 3 months approximately.
About 3 months. You can feel it kind of starting to wear off, and I felt it in. Again, I started being more
aggressive.
Aggressive, but more snippy,
less tempered.
Right, less tempered. And it was the first one was great. It took a few months for them to schedule the second one.
Why is that?
I don't recall.
It was the holidays and all of that. Like, I mean, to be honest with you, like it was because it was wearing off right around October. We had the upcoming appointment with him in November. John also had hurt his back in the time being. So we were trying to get him in for that. Like he wasn't even able to like walk at the time.
Yeah.
But, go ahead.
Wondering if Tracy's wondering if it's that types the blocks that they use for surgeries.
I'm not certain. I'm sorry.
I'm trying to
I
find
will,
where it's at. Hang on.
She'll find it.
Looking
And
for.
if she doesn't find it before the thing is over, we'll post it somewhere in the answers. If I can't find it, I'll call one of the
You can
docs
tell
and
them
ask
whose
them.
fault it is that I don't have this stuff ready.
But
Tell them who was distracting me when I was trying to read this.
Okay,
John,
so
are you out of John? Are you out of building 228?
yes,
Okay.
John, so 3 months, you're feeling great, made a
Mhm.
huge difference in your life.
Right.
So then you make your appointment for your second shot. Tell us about the second one.
so
Right here, it just says local anesthetic. It's just an injection of local anesthetic. And it doesn't say anything about like steroids or anything of that nature. For what is that I'm seeing here, that I saw it all, period. Because to be honest, I would have questioned anything else besides that. The whole point of this is that like it's the least amount possible that you're putting there to reset that nervous system, to stop it from being fight or flight, to shut it down from war, and then let it kind of come back on, or to just come back online and be tempered in the way that
it's a hard reset.
most people, right, exactly. And unfortunately, the long-term effects of it are what they don't really know for sure, especially for the veteran community.
Right.
But they're like, it's 70 to 75% of veterans see an improved, like, immediate effect from all of this. And it's most effective for veterans in their late 30s through their 50s. And then it's like all the trials and stuff like that are online, and you can you can look it up. Like, to be honest, like I just did my own, like, I hate to say this, I hate to phrase it like this, but I did my own research. I'm sorry, but anything with the VA, I feel like is necessary. And I know steroids, but at the same time, I believe it is just anesthetic.
Yeah, it's I think it was either 3 or 7 cc's that he ended up.
Here, Ripple-Vacaine, or
yeah, type that in. She's gonna type it in.
How do I type it in?
The actual.
Comments. Okay, join the chat.
Now, is this procedure done in an office, or how does that work?
So it is done in the surgical unit at Heinz, or at least mine was the outpatient. I think second floor has an outpatient surgical center.
Okay.
And that's where it's done at. So the procedure itself is like 15 minutes.
The first one he had was done like first thing in the morning at like 6 o'clock in the morning. And to be honest, I believe that was part of the reason why the first one went better. Because the second one being done midday, and it just made it complicated things a little bit more. And then
right. So for the second one, I had it done midday. And I came home to.
No, it wasn't even. It was driving there, getting back.
Well, no, there was a bunch of things going on, and that jacked up my stress levels at home. My daughter was trying some new hair dye system where she. There
wasn't even that though.
Well,
you were having problems by the time that we were leaving because you were nauseous. You couldn't drive.
Right.
You had the migraine, and then you tried to eat, and it was hard chewing because of.
Right. That's all problems with the procedure. Like
that's what I mean.
I'm talking about problems with after coming home, like the next day.
I'm saying the differences in the procedure time, like being operated or operational, affected the way that you were able to like reset from that, you know.
But it I don't. After the second shot, I don't feel the same as the first one, but I think that's because my stress levels are like 10 times higher. I came home to a bunch, like my daughter, I love her, like I said, but she broke the plumbing with this hair dye that she tried making. So it was that, and then the stuff, I ended up having a plumber come out. I was outside for hours trying to resolve it myself, but there's just, I don't know if it was a stress level in myself, And one of the good things about Dr. Buckley doing this, he does a follow-up the day after, and then weekly he'll follow up and keep pretty specific notes. So I'm going to tell him, I told him so far it's been I've not negligible, but I don't feel it the same as with the first time. And my next appointment with him, I think, is tomorrow. I'm going to talk about it, and
Well, I have a question.
Yeah, send it.
You got the shot the first time, and then you had that little bit of numbness in your face. Did it happen on the second time too?
Yes.
Or did it not?
Yes.
Oh, it did.
That is how they determine whether the stellate ganglion block is successful or not. Like that is the sign of it, because it's supposed to.
So it happens every time that you get that shot.
Yes.
So
but it goes away.
Yes.
Within 12 hours.
Oh, okay, great. Great.
So you get the shot, and then you have to sit in the recovery room for like an hour afterwards, and with that, they're just monitoring to make sure that you can start drinking again, because the one eye is going to be dilated really big. You get a sore throat for a couple hours, and they will monitor that and make sure that you can start eating and drinking. And then you go home, fall asleep, and by the time you wake up, it's pretty good.
Sorry, Mike. It wouldn't let me type it in the chat, so I said Mike.
Well, then tell us what it is.
That's one of them. She's got one of them, and then it's bupivacaine also, and it's 7 cc's of 0.5% solution. And the types of imaging he was talking about that they use beforehand are ultrasound, fluoroscopy, or computed tomography are recommended to visualize it.
Yeah, it's a really specific and precise spot that they have to get, and like there are some dangers of them missing the spot. He said that happened more before they were using the scope or what
the imaging thing
before they were using the imaging while they were doing it. That was more common, that they could miss the spot, and that's. I mean, there are some risks as with anything, but it's pretty minimal.
He can like see your like veins and stuff like that. Well, I mean,
yeah.
Are you numbed up, John? Are you numbed up?
Yes. So they numb after a while. The hardest part for me, at least, you got to you hold your head in a specific position, and then they keep pushing down to try and find the right spot, and they'll find it, and you're like, sweet, and then I'm thinking the spot is so small I shouldn't even swallow, so I got some covers on my face, and I'm trying not to drool on myself while I'm laying under this blanket, and I asked him afterwards, like, oh, no, it's fine, you can swallow, it's not that small of a spot. Damn it.
And like on a side note, if you are caregiving for a veteran, they did and do give you a difficult time about being in there pre-op and post-op, but I firmly and calmly pushed back both times, and I was able to get in there with him, because I have the information about the things that are going on before that, like what his medications are, what his
meds, food,
right, exactly. And then afterwards, like I'm not as concerned afterwards, but it was the beforehand that I was really trying to make sure that they had all the correct information that they needed beforehand. And that's something that the VA is like typically not great about, and I can personally say from experience.
Right. It is. I'm thinking about it more so now, like right now as we're talking, and I can definitely feel the difference now after having the second one versus prior to it, the few months without it. And
one of the things that they say that you should be doing with it, partnering with it, is therapy or whatever else that you are doing for the PTSD in a treatment way, so that they can work combined. But one of the reasons why the stellate ganglion block is good on its own is because you're treated there at the VA, so you don't have to worry about a follow-up. You don't have to worry about making another appointment. Like all of those things kind of are alleviated from it. And then it's something that is a physical way to treat a mental.
Well, it's
like, I mean, that's what it said in the paper. Like, is that like it alleviated or it would alleviate like preconceived notions essentially.
But it is working a lot more than like I've been in counseling. I've done meds. I've done CBC. No,
John, when you first came in our program,
yeah,
you had to be on like 15 meds.
Yeah. When I got out of the Corps, I was on 18 meds a day.
Right.
And some of them I would take like 3-4 times a day. And with the traumatic brain injury, my short-term memory was my short-term memory was terrible. My bad.
Don't worry about it.
We're good.
I would forget that I took the meds. So I would take them and then take them again.
And not to mention ordering and having them like on hand and all that kind of stuff was
it turned. I can't tell you how many times I accidentally overdosed on all the meds I was taking, just because I couldn't manage them. And eventually, that's when my wife stepped in and was like, you know what, you need help with this, and she took over managing my meds and my doctor appointments, and a plethora of other really important things. But even with all the meds I was on,
he's down to 5 now, which is
I'm down to 5 now, which is awesome. Wow. And
do you think that shot made you reduce your meds?
So
everything, the amount of medicines that he's been on like the 5, that has been for at least a year, so that would have been before the shot.
Okay.
Yeah.
I recently had talked to a neurologist about gabapentin, which he's been on since he got out of the Marine Corps, because I had been reading about how that was causing long-term Alzheimer's
neurological problems.
Yeah, especially like Alzheimer's
so
exacerbation.
So no, it didn't. I didn't replace any other meds with that. And
but you got those medicines down, like
I've gotten down even the doses of like the fluoxetine and the bupropion, all the fun.
The ones that are I'm on.
Right, exactly. Even that, I am down to like I'm not maxed out on those. I'm not at the max dose. I was able to come down.
He also is he also has a shot that I give him monthly called Amavig. That is for his migraines. Mm-hmm. That helps tremendously, with those. So I mean, that's the
So I'm still taking those, but I've been able to come down on the dosage. I mean, I could try going off of it, but it seems to be going pretty well, and I don't want to mess with it.
When I get on the same page as all the doctors and everything, and we're all kind of understanding that there's a good thing going. We try not to rock the boat if we can help it. And I really do monitor and keep up to date with the doctors and all that kind of stuff as far as what and how all those things are affecting him. So, I mean, 2 of them one of them is an allergy medication. So, I mean, that's so, I mean, technically it's 4, but I do want to read to you guys really quick the 3 things that they said from this, the thing about what it was that, about why this is so helpful. It's because it may destigmatize treatment by offering a biologic approach to PTSD. It's because it may offer a faster acting treatment alternative with improvements reported within 30 minutes to days after the procedure. And it increases compliance as it does not require continuous daily or weekly administration. So that was the 3 reasons that they felt that it was so impactful. And I feel like I 1000% agree.
Yeah, they're I talked with Dr. Buckley. He said they're doing more of them at the VA. And he strongly recommends it. And I met him the first day for this procedure just in his office, and I was talking to him, and he went on and on about how much he believes in this procedure, and its effects.
And
you would recommend this to everybody, correct?
Absolutely. Yeah.
We even we both have the same counselor at the VA who we love very much, and he's a combat veteran as well.
Mm-hmm.
When it was brought up to him that John was getting this stellate ganglion block, he said that he was very optimistic for how this would work out for John, because and he said he didn't want to jinx it, but there's not a veteran that he can recall in recent history that had gotten one of these and didn't see at least some improvement. And I mean, that's saying a lot, because he sees a lot of people, and he's a very straightforward, to the point man. And
John, I want to thank you for coming on tonight and sharing all this information.
No,
Joe, if you could type in after the podcast, if you could type any information that you want to type in. I know you couldn't do it, but I think after the podcast, you can go to our page.
Okay.
Type in whatever information you feel is relevant.
Awesome.
To the treatment. John,
I'll share the thing that the executive summary thing that I've been reading off of. I'll throw that in there so that everybody can look at it themselves.
John, I'm so happy for you. I've known you a long time now, and just talking to you tonight on this podcast, I'm going to tell you, you're a different person. You really are.
I may have undersold how effective this is. Halfway.
No, you did a good job, bro.
But it is life changing, and if you've got an opportunity to even apply for it, go for it.
And if you can find us, feel free to reach out, and we will try and help get you through the process of getting it done. Because I mean, it is really, I heard about it years ago, thinking that it would be like this, and for the first time in a long time, something was like this, and
was actually as advertised.
Exactly.
So,
yeah, Joseph, you can put any information out there that you feel is relevant. I mean, I think that's why it was so important when John told me about this treatment, that we had to get it out, because it's just so important that we let our veterans know that there is help out there, and that there is something they can do through the VA that will help them, and it's relevant to what all our veterans are going through. So I want to thank you for being my guest tonight.
Thank you for having us, Mike.
Thanks,
I love you.
for everything you do. You do
God,
so
you're
much.
the best.
Take care, guys.
It was nice meeting you, Ken.
Nice meeting you both.
If you got any questions, feel free to reach out.
Have a good one,
You
guys.
got it, brother.
All right, guys.
John, keep in touch. Joe, I love you.
Of course. Love
All
you
right.
too, Mikey.
Love you guys.
Bye-bye.
Bye.